So Dean Lang, would you like to start us off?
Yes, thank you so much, Mindy, for this wonderful invitation. And greetings, everyone, and thank you for joining us. I'm delighted to welcome you to the We Are Climate Action speaker series and to our launch event for the academic year 21-22. This has been such an ongoing and longstanding series, and it's brought climate, public health, and environmental issues to faculty, staff, and students at Baruch and to our larger community. It's always been a relevant topic, but never more so than now when we're facing the longstanding impacts of climate change on life expectancy, quality of life, health, our personal economics, and the well-being of our children and future generations. Recent conversations have stressed the urgency for awareness and change, and not only imminent consequences, but actualized ones, so the ones that we're experiencing now. So I want to thank our four guests for joining us this afternoon to discuss climate change, health impacts, and health policy. I'm honored to introduce four nationally recognized scientists and public health experts who will be leading this discussion. Professor Elizabeth Geltman, who is at the CUNY School of Public Health, will serve as our moderator. Jeffrey Shaman, Director of Columbia University's Mailman School of Public Health's Climate and Health Program. Jeremy Hess, who is the director of the University of Washington Center for Health and the Global Environment, and Kim Knowlton, who's a Natural Resources Defense Council senior scientist. I also want to thank our very own Professor Mindy Engel-Friedman for her tireless work on environmental studies and her action here at Baruch to educate us as a community. She's expanded her reach and our knowledge with the We Are Climate Change series, and I welcome all of us to join her in these efforts. Thank you so much, Mindy.
Thank you, Jessica. Dean Lang, for your lovely introduction. Dean Jessica Lang is committed to climate change research and education and all of our climate-related initiatives at Baruch and the Baruch Climate Action Collaborative. We are a group of 9 faculty members from the 3 schools of Baruch, the Weissman School of Arts and Sciences, Zicklin School of Business, the Marx School of Public and International Affairs. I'd especially like to thank Dean Lang for her support of our ongoing speaker series, We Are Climate Action. We work as a team to bring speakers who discuss cutting-edge climate change research and policy implications to Baruch, to CUNY, to the New York City communities, and now with Zoom to the world. So many thanks. Welcome to our audience. We appreciate you taking time today to learn more about the implications of climate change on the health and well-being of our communities, how our health policy will need to respond to keep us safe and well. It's a big question, and hopefully our speakers today will help us understand and expand that idea. The health impacts of climate change will affect everyone. I'm grateful our moderator, Professor Elizabeth Ann Glass Geltman, will direct today's Zoom conversation and introduce our speakers. Professor Geltman is a professor of environmental health policy at the CUNY School of Public Health and program director for environmental and occupational health sciences at the School of Urban Public Health at Hunter College and the City University of New York School of Public Health. She is director and principal investigator of the Atlantic Emerging Technologies and Industrial Hygiene Training Center, funded by the National Institute of Environmental Health Sciences Superfund Research Program. Professor Geltman serves as a secretary of the Environment section of the American Public Health Association, where she is chair-elect of the Law section of the American Public Health Association. Professor Geltman is also a lecturer at the Krieger School of Arts and Sciences at Johns Hopkins University. She is the author of 17 books on environment and natural resources policy. Her research focuses on strategies to advance public health through better policy. Please help me welcome Professor Geltman.
Thank you very, very much. I appreciate that. Today, we're going to be talking about climate and the change and the health impacts. And I am delighted to talk to you all about it at a time when the issue is really in the news all the time. We are looking and watching here in New York City. We experienced the impact of Hurricane Ida, following up on Hurricane Sandy. So we're acutely aware of the impacts of climate change on an almost daily basis here in New York City. We're watching what's going on with the fires around the West Coast and different types of things. And we're experiencing COVID-19 and the disparate impacts of that in different particular areas. And so I'm delighted to go here and introduce these other panelists. We have divided up the different topics. And since you've already had an introduction to Dr. Knowlton, Dr. Shaman, and Dr. Hess, what I'm going to do is outline the order of play today. So Jeffrey Shaman will start off first, and he will give an introduction to the topic of climate and health and explain cutting edge research in the fields and sort of the research horizons. Dr. Jeremy Hess will follow next and speak about what research is needed and what the academic world is doing in the 2 decades that we've been studying this, and how this affects climate and health equity. And then finally, Dr. Kim Knowlton will swoop up afterwards, and she is going to talk about the intersection of climate and health and science, and more importantly, the advocacy work and public action work that she is doing in order to try to address those issues. So with that, I will keep my words brief. If you have questions, please put them in the chat box. We'll be monitoring them. All questions will be at the end after all 3 speakers have spoken. So we'll have a question and answer session. And then at the very, very end, I will call on the 3 speakers to sort of sum up and give us pearls of wisdom to take with us as we go. So with that, I'd like to turn it over to Jeffrey.
Thank you, Liz. It's a pleasure to be here. I'm going to talk with some slides, so I'm going to share my screen now and give you a bit of an overview on the topic of climate and health, at least as I tend to look at it. So you're going to get a little messy view of my desktop, which will quickly, hopefully, disappear. Can everybody see that? Wonderful. So, there's been a growing scuttle and recognition that the health impacts of climate change are going to be profound. It took some time before this really to reach the stage of collective attention that the topic demands. It was a little bit slow, if you ask me, as has been the response and recognition of the threat of climate change. But I would say even then, climate and health has lagged. There have been a series of commissions that have been put out reports. The Lancet is one of them. Obviously, there's the IPCC report. There's the US climate health assessments that have been done that have looked at the health impacts of climate change. And I think it's important to frame this as both a problem, but also an opportunity, which is something that the Lancet Commission landed on in their 2015 report. And I show 2 quotes here that sort of summarize that. The first, that climate change is the biggest global health threat of the 21st century. That's what they put out in 2009. But subsequently in 2015, they said tackling climate change could be the greatest global health opportunity of the 21st century. And the thinking there is that while the problems are enormous, while climate change seems to be inexorably growing and problematic and leading to all sorts of health issues, some of which I will talk about in a moment, there are also opportunities, if we're smart about this, to rethink about how we keep populations healthy, how we keep them safe, how we prepare and predict and prevent and respond and implement resilience within our communities. So I think it's very important not to be despondent when looking at the threat that's posed by climate change to human health, but to also seize upon the opportunities to do some good, not just in a reactive fashion, but in a proactive fashion. So, well, will it advance? Hold on a second. Let's see if we can get this to advance. No. All right, let's try again. We're going to try one more time and see if we can make this work. We'll share screens and we'll go straight to the PowerPoint this time. Let's see if we can make it advance. Much better. All right, so much of this is predicated on the acceptance that global warming is a real phenomenon. Fortunately, I think for the most part, we put that debate behind us, though in some quarters, even within the scientific community, there are still questions about it. This plot right here, which is from NOAA, shows surface temperatures averaged over the 5-year period from 2016 to 2020 relative to a 1951 to 1980 climatology. What you can see is that over most of the globe at the surface, there is evidence of warming, and in some instances, particularly over land masses, particularly in the northern hemisphere, and particularly over the northern polar regions, that warming is profound. If we look at this in a collapse fashion as a time series, and this is the NASA GISS global mean estimates of land and ocean surface temperatures, what you're seeing are annual mean estimates and a lowest smoothing running through the whole thing. You see a temperature anomaly, again, relative to that 30-year climatology from 1951 to 1980, which is in the middle of the plot, obviously. And what we can see there is that prior to 1950, temperatures were bouncing around. They were a little bit colder. They were a little bit warmer at times. And then once we got out of the 70s and moved into the 80s, we've had a 40-year period of inexorable growth in temperatures. There's been some variability around it. And if you want to grab a few years, you could say, oh, it's stagnated. But a lot of that may be linked actually to variability in the Pacific with the El Nino Southern Oscillation. So what we have when we look at the red line, the trend, the smoothing average of it, is an indication that indeed the temperatures are warming. And of course, this is backed up by the ability for physical models, climate models to replicate this, understanding of the underlying physics, the radiative dynamics and thermodynamics at play, and certainly understanding of the paleoclimate system and the implications for what that means that the climate system is capable of doing, how it can quickly shift if it is poked and prodded, as it were. Now, at the very bottom, you'll see some indicators there. These I pulled off just a couple of days ago from a NOAA website on climate, and it shows levels of carbon dioxide, probably taken at the Mauna Loa Observatory in Hawaii. It shows the global temperature change since 1880 in degrees Fahrenheit. It shows Arctic ice minimums, the percent change per decade, and it shows what's happened with ice sheets across the planet, as well as the rate of sea level rise. All of these are unfortunately trending in the wrong direction, indicating that the planet is in disequilibrium, it's transient, and it is moving towards a warmer state presently. Now, it's not just that the average temperature is warming. There are problems associated with it that are going to manifest that are going to be more regional and temporally specific. One of the most striking examples, of course, is extreme weather, coming in the form of heat waves, of droughts, of deluge flood rain events, such as what we had in Ida, and any sort of extreme storm that might happen and take place. These are expected with some intensification of the hydrologic cycle. The warming of the planet results in an increase in the capacity of the atmosphere to take on water vapor at equilibrium or saturation point, and that can lead to more intense rain events such as what we're seeing here. And so one of the questions we could ask is on the tails of Ida, is it expected that we're going to see that kind of intense rainfall? Are we going to see that kind of return period where we're going to get hourly rainfalls in Central Park, New York in excess of 3 inches, which had not been seen before? That's the kind of extreme weather that we're seeing. In the instance here, global warming is allowing those extreme tail end events that maybe happened previously 1 in 1,000 years to happen 1 in 100 years, 1 in 50 years, maybe it's 1 in 20 years. We don't really know the statistics as of yet, but we've prodded the beast, as it were, and we're allowing these to happen more frequently. Another example, of course, would be what happens when we dry out our environment. The fires that we've seen in the West Coast, in California this year, in Oregon as well, the ones that have been happening in the Mediterranean, in Greece, and in Turkey, those are all examples of instances where both warming temperatures and changes in the hydrologic cycle are actually putting in place conditions so that we can have these fires that are much more extreme than we've been used to in prior portions in the mid and early 20th century. We're able to actually seed the growth of vegetation through some rainfall in the instance of California. This allows a greening up with some deluge events, but then it gets dried out, so it's brittle dry, and then sparks, lightning strikes, bizarre parties lead to fire events that take place. Associated with this is a whole bevy of health events or health outcomes that we need to better understand. So for instance, what are the human health impacts of wildfires? These are really only beginning to be understood. I think there's a lot more work that needs to be done there. Certainly the pollutants and the elevation in particulate matter here on the left, it's showing particulate matter 2.5 microns or less. And we see it over the course of a number of fire events. And you can see that when it's during the fire event, the air quality is quickly eroded with the elevation of PM 2.5 levels. That can exacerbate asthma, other chronic respiratory diseases, lead to influxes of patients into emergency services, which require a hardening of those emergency services to respond to it. And of course, there are implications for other forms of morbidity as well as mortality. All this comes from the fact that wildfire emissions are PM 2.5, but they also can contain some noxious combinations of inorganic gases, hydrocarbons, and oxygenated organics. And once again, my PowerPoint has frozen. All right. So we are going to pull out of the sharing once again. I apologize for this, and we will try again. All right. Let's go back to PowerPoint and see if it will let me advance. There we go. So what are those human health impacts? Well, obviously, if you're having elevated exposure to the wildfire smoke, you're going to have all sorts of attendant effects. Those can include pulmonary inflammation, systemic inflammation, oxidative stress, immune dysregulation. I find it ironic that this is a picture there from late 2017 of them handing out masks in response to the fires in the Santa Barbara area and closing schools there. Obviously, we've had a lot of issues with masks of late as well in a different context. Another big problem that we see associated with climate change and warming temperatures is glacial melt. You see on the upper left, the Muir Glacier in 1941, and about 60 years later, how much it had retreated. We hear stories about rainfall in the center at the summit of Greenland, the first time it had ever been recorded there, and the melting of glaciers at an accelerated pace, and the risk of the West Antarctic ice sheet moving and collapsing into the ocean. Of course, these are going to freshen the ocean enormously, but they're also going to, in perhaps catastrophic ways, raise sea level, which is, of course, going to be devastating for coastal communities that at present are really ill-equipped to deal with it. The health consequences of that in terms of forced migration, and particularly for those who are disadvantaged and lack the economic means to move themselves out of harm's way, will be potentially devastating. So one example of this would be to look at South Florida in our own country, very low-lying peninsular Florida, of course, and this is just an image on the left showing you what the current borders of the sea are and what might happen with an elevation rise of sea level of 5 meters and then of 10 meters. And you can see how much of peninsular Florida is underwater. It should be noted that this is a very difficult circumstance in a place like South Florida, because their landscape is built, the whole area is on limestone, which is itself very porous, and Florida already has tidal flood events in downtown Miami, which is a shot of what you're seeing there. It's a clear sky day. There hasn't been rainfall. This is not a flooding that's come from the atmosphere. This is sea level incursion with a particularly high tide that has bubbled up through the limestone underneath the streets and flooded the streets of Miami. Here's another shot that just shows you an image for Manhattan and projected flooding of lower Manhattan. We could see this for lots of other coastal communities as well. There's also, of course, an existential threat for some societies. Just to put a finer point on this, this is the island nation of Kiribati. It averages less than 2 feet above sea level. A rise in sea level, of course, would be devastating for it. And then you'd have displaced persons who are without states. And what was going to be done with that? Who are going to take on these refugees? And how is this culture and way of life going to be maintained? Now, one of the more complicated things to think about is that in addition to having some more direct effects, climate change can also act as an exacerbant that ultimately has a lot of attendant effects on health. Conflict would be a great example of it. I point to the maps on the lower left, which shows Lake Chad, which is this trans-boundary lake in Central Africa that traditionally spanned about 5 countries there and had 11 countries with water that fed into it. It has been drying out in this area for some time, which had led to an inability of people to sustain themselves using fishery industry. They switched to agriculture. When they moved to agriculture, they started siphoning water out of the lake, which further intensified its drying. And you can see that the lake is basically a shell of itself at this point. In addition, in this area, because it's transboundary, There is no authority for regulating the use of water. There are enormous ethnic and religious differences there, and there is a lot of fighting and war. So the consequences of climate change are not always going to be direct. Many times it's going to act as an exacerbant on situations that are already brittle. Food security may be another one of that, in which the disruption of the climate system leads to changes in temperatures and precipitation in extreme that threaten agricultural productivity and the ability for many parts of the world to feed themselves, particularly in areas where they rely on subsistence farming. So when I think of climate change and its effect on health, I'd like to break it down into three categories. I think about direct effects, which maybe we put heat waves in there and the heat morbidity and mortality associated with them, things that Dr. Knowlton studies quite a bit, or all the impact of extreme storm events. I also like to think of more indirect effects, changes in air quality, the wildfires and what that does for respiratory conditions, changes in pollen seasons, exacerbations of chronic disease, water, food, and vector-borne disease, and mental health issues. But then that last category, which I alluded to last, was these complex downstream effects, where the climate system and its changes are pushing and pulling on already fragile systems that are larger in some sense: food security, water security, climate refugees, and conflict. So there's a lot of complicated things going on. It is fairly clear, and I should probably update this to IPCC 6, that we have a warming planet and that it is going to continue to warm for some time, even if we can come together and stop things at 1.5 or maybe more realistically 2 degrees. We have some baked in warming taking place and some shifts in the statistics and the variability in the system as it supports human lives and livelihood. It is a complicated system. There are lots of changes to the climate system that vary on regional scales and temporally, and those have many different types of impacts and their effects on health. This shot is taken from the CDC. And it's also very important that even within the effects of climate change, there can be multiple simultaneous disruptors of health. And this is a shot from a year ago when the Atlantic Ocean around this time of year was littered with tropical hurricanes, tropical storms, hurricanes, and depressions. And there were wildfires going out on the West Coast. And all of this was happening at the same time as we had a pandemic taking place. So we have a lot of conditions to deal with. There's a lot of work to be done to understand this, to develop response mechanisms, and to make society more responsive, resilient, and prepared for the outcomes that we are going to be facing in the coming years. So with that, I will stop. Thank you so much.
Excellent. Perfect timing too. With that, I would like to turn it over to Jeremy.
Great. Thank you. Thank you for the opportunity to speak with you today. And thanks to my co-panelists for coming together and putting together this really outstanding series of talks. And thanks to Jeff for teeing me up well. I am also going to share my screen. With luck, we'll be able to advance and everything else. We'll see. All right. So I decided to take a slightly different tack on my remarks today. I'm still going to be speaking generally to the question of what the academic health sector should be doing around research and other things to advance the climate and health agenda and address all of the concerns that Jeff laid out so nicely. But I actually want to speak a little bit more broadly as well, because I have worn a number of different hats over the course of my career. And that's led me to wrestle with a lot of different issues around advancing climate and health work, both as a scientist and as a physician, and as a practitioner in an academic medical center more broadly, and a faculty member concerned with shepherding the institution's activities around climate and health. So I wanted to speak with you a little bit more broadly about principles for the academic health sector's engagement with these issues. And I've outlined 7. I think it goes without saying, but I'll say it anyway, that climate change is ultimately about health and well-being. And Jeff emphasized this nicely, showing you the wide range of ways in which the exposures and hazards associated with climate change are likely to impact our ability to live and work in the ways that we have and in the places that we have up to now. And we know these changes are accelerating. We are working to reduce the likelihood of really dangerous climate change, but the verdict's still out whether we'll be able to do that. And it's becoming increasingly less likely that we'll be able to do that, and increasingly more likely, correspondingly, that we're going to have some really very difficult choices, and in some cases and places, relatively catastrophic risks to address. And so it's in that context that I offer these principles and opportunities for storytelling. These are the 7 principles that I outlined. And I'm, one, speaking to the younger people in our audience. Climate change is an equity issue, and this is about generational equity among other equity considerations. And our institutions that serve young people need to be more responsive to your generation and your needs and the impacts that you're going to experience. And so that leads me to the second principle, which is accountability. I want to encourage you to require some accountability from the institutions that you're involved in. I also want to talk about risk. So we need to, climate change is ultimately really about a wide range of different risks and how they interact, how we anticipate and manage those risks, and how we recover from them. And that kind of thinking gives you a lot of insight into how to move forward with climate and health research and other activities. Same is for prioritizing vulnerability, and I'll talk a little bit more about vulnerability's important role in risk and risk management. Fifth, I want to encourage you to be ready. You're starting to see the need to respond very quickly to some changing circumstances, but I think this principle extends to your engagement with your family, with other institutions that you're a part of, and even generally to a mindset about how you approach your engagement with climate change more broadly. Lastly, I want to encourage you to engage and connect. Climate change and action around climate change is facilitated by communication, and we all need to learn to communicate more effectively, myself included. It's something that I've definitely worked on over the course of my career and have not fully realized an effective voice around climate and health communication, though I'm trying. And then connecting. Jeff opened by saying that a lot of this can be upsetting and potentially paralyzing. And I think connecting with other people, again, within your institution, within networks, and in your communities will really see you through. So I'll start by talking about intergenerational equity. Your class, again, speaking to the young people in the audience, will be working into the latter part of the century. And during this time, the world's going to change profoundly, not just because of climate change, but certainly that will be a factor. But the population will continue to grow by perhaps 2 billion. The temperature will rise probably by about 4 degrees Celsius. That's global average surface temperature. Temperature over land, which is where we spend most of our time, will be higher. And our sea level rise will be probably at least 1 meter by the end of the century. And most likely, as a result of these shifts and pressures, hundreds of millions of people will migrate. And this will be migration between countries. This will be migration within countries. And it will prompt stresses on our societies that we really haven't had to face recently. Your generation has some pretty different long-term interests than ours does. And we need to hear your voice. We also need to, you need to expect that we will listen, which leads to the second point, accountability. I've spent a fair amount of time in my role at the University of Washington trying to spur action around emissions reductions and promoting climate change and health. And as Jeff alluded to, action around climate and health has been slow. It's been timid, and it's been essentially more of the same. People have tried to approach a fundamentally new and different problem with the same tools and thinking that they've used to approach other problems in the past. And clearly it's not really working that well. The healthcare sector, healthcare delivery in particular, emits more carbon than all of the world's air travel combined. And those emissions are associated with air pollution emissions that are very harmful to people's health. Yet healthcare doesn't really take responsibility for those harms. They're real, but and they're on the order of magnitude of medical errors, which we do take responsibility for, but we don't include sustainable operations and reduction of greenhouse gas emissions and other air pollution as part of our quality control in healthcare. And similarly, universities have led the call for sustainability and really done a good job of highlighting the importance of climate change to health, but they really haven't been great leaders in terms of action around these issues. And I looked at CUNY's sustainability page today. I didn't really see a dramatic emphasis on climate action. Probably I didn't spend enough time on the site. If you look at UW's pages around sustainability, you'll also see a similar dearth of really galvanizing information about how we're acting to reduce the likelihood that this will become a catastrophic problem. And I want to encourage you to hold your institutions, CUNY's and others, responsible to act. Also want to focus on risk. So in IPCC and other assessments, we think about risk in terms of a combination of the hazard or the extreme events in many cases, who's exposed to that hazard, and then what makes certain people among the exposed more vulnerable. We also think about risk management, and sometimes you can avoid a risk. You can sometimes, in the case of climate change, we have the opportunity to determine at some level how bad the risk is by contributing to its generation. Once the risk is out there in the world, sometimes you can avoid it. You can, in cases where you're not able to avoid the risk, you can minimize its impact. And you can do things like invest in insurance schemes to promote recovery. It's very important to ask with climate change, who's protected from climate-related risks and why? Who suffers the losses when we're exposed to climate-sensitive hazards and why? How do they recover? What are the consequences of recurrent losses when someone is flooded repeatedly and then exposed to heat waves and it impacts their health? They don't have health insurance. They bear the brunt of all of those bills and costs. There's a better way. And in fact, we know that we have a lot of information about how to price and manage risk and encourage recovery. But we're only starting to use that information in certain cases. Tomorrow, I'm happy to note that FEMA is raising prices for coastal insurance. That's been probably 20 years in coming, and we've known for a very long time about how to price risk appropriately. We just haven't had the political courage to do it. Now we are doing it, and it's likely to result in a pretty significant shift in coastal development, and that's great. And that's a good example of this, but we have examples of this throughout the hazard landscape, including with health. And we know that the way that we organize healthcare and to some degree public health in this country is really inefficient and inequitable. And we know that there are better models, and yet we continue to ignore most of that evidence. Which leads me to prioritizing vulnerability. I want to highlight that in climate change work, we often start with the hazard. We start with how the climate is changing. And that's important. We need to understand how these hazards are shifting, wildfires, extreme heat, et cetera. All of that, that's the source of the problem, right? Well, it actually turns out that the source of the problem is more likely the population's vulnerability. And when we take a close look, and I include here an abstract from a paper that came from colleagues in Arizona, where they've been doing great heat-related programming for a long time. They have found that despite their best efforts at reducing exposure and understanding the associations between heat exposure and health impacts, they still are missing a lot and not as effective as they would like to be, because they haven't been paying enough attention to what makes communities and individuals vulnerable to extreme heat, and what also tends to short circuit some of the effectiveness of interventions that are aimed at reducing risk. And this is a theme that cuts across all of climate and health work, that we need to spend more time on exploring and reducing vulnerability through our health programming, and less time focusing on the exposure assessment and some of the other things that are frankly more familiar to us and that we've been trained to do. And we need to focus on equity throughout that, because we know that equity and inequitable distributions of exposures and vulnerabilities are driving these inequitable impacts. And these inequitable impacts, the EPA just came out with a report a couple of weeks ago and really didn't have the splash that I hoped it might. The impacts of climate change, impacts of fossil fuel pollution are inequitably distributed and particularly impact Black and other frontline communities. The impacts of climate change are currently inequitably distributed, and the inequities are expected to grow as climate change worsens, and we need to address vulnerability to address that. And then speaking again at a more individual level, I want to highlight the importance of being ready. Here I'm speaking somewhat as a physician. I was taking care of patients in our emergency department during the heat wave we had this past summer in Seattle, which was devastating. And part of the problem was we have never experienced anything even remotely like that here. And I, of all people, certainly knew that it was possible that we would have something like that. And yet it still took us and my group of physicians with whom I interact pretty extensively around climate and health. To some degree, it took us by surprise. And we did not have good reflexes for addressing this problem. Some of this was that because we have never experienced that kind of risk here, we really didn't prepare as adequately as we should have. But we know what happens when an unprepared community is exposed to extreme heat. We've seen it happen in Chicago, we've seen it happen in New York, we've seen it happen in Paris, and now we saw it happen in Seattle. And I could have told you exactly what it would have been like, and that's exactly what it was like. It was very sad to see all of these people dying, some before they could get to us, some under our care. And we really knew what we should have done, but we didn't do it in advance. So be ready for these events. Be ready to evacuate when you need to. Be ready to reach out to your loved ones and take the information that you have and apply it in the places where you are. Engage. So coming out of that, one of the redeeming features of that experience for me was being able to participate in a webinar that Jeff's group organized. The Consortium on Climate Change and Health has done a rapid response series of webinars on the extreme events we've experienced this year in the United States, this past summer in particular, and brought together a lot of different practitioners, but particularly physicians and particularly emergency physicians, to speak about their experiences with extreme heat, with wildfires, and with storms. And it's been very moving, but it was also really, I think, important because stories are what move people. The numbers give you context, they allow for sober assessments, and those are fundamentally important. But the stories are what move people. And I encourage you to learn how to communicate your stories and use that to galvanize action and to connect with people so that you feel like you're not always alone. And that brings me to the next point, that community will see you through. The connections are protective, and this is a hazardous issue to be engaged with. It's upsetting. I know myself, when I started working on this in around 2006, 2007, I went through a couple years of kind of a mild depression about what we were facing. That has only deepened at some level in terms of concern. But my mental health is better because I work with so many different people to try and address these issues. And we're making good progress in some areas, and we're protecting the places and the people that we want to protect. So I encourage you to come together within your institution, come together within your communities, learn, act and serve, and it will help. And with that, I'll close. I look forward to questions. I know that this was perhaps a bit orthogonal to what you might have expected me to say about climate and health research, but it comes from lots of experience around trying to advance the overall agenda within the academic environment. I'm happy to answer more specific questions about climate and health research during the question and answer period. Thank you.
Thanks, Jeremy. Kim, you're up next.
Thank you, Liz and Jeff and Jeremy for really powerful, a foundation for what I'm going to talk about, which is also more on the side of how the science, the strong science that each of you and the community of climate and health scientists have developed and continue to develop. How do we translate that into action? Along the lines of what some of the points you were bringing forth, Jeremy, I want to raise a few points, some of them based on my experience at the Natural Resources Defense Council, and some from our shared experience, our lived experience of the last decade and more, that I'm sure the people in the audience, the students and more also share. I want to raise a couple points without slides about the moment in which we live and some elements of these responses, as you eloquently described, Jeremy, to what we're experiencing that can help us move toward action. And I'm going to share some of the actions that are taking place that are very positive, while we don't diminish some of the very real responses, individual and otherwise, that we're having to the times in which we live. Times that are very much affected by the health impacts of climate change, the environmental impacts, and the overall anti-science climate, no pun intended, in which we live. There have been in recent years, not too distant past, and continuing right now, some efforts, even at the federal government level to the local level too, among our fellow people in the United States, our neighbors, our family members, kind of diminishing the traditions, the finding of science. There have been rules that would severely limit the use of peer-reviewed science in making health-based standards at the federal level. We're trying to move away from those now and more toward the application of this good science, this strong foundation, thousands of papers now in the academic literature documenting the connections between climate change, environmental change, and health. But how can each of us, both as researchers, as students, as advocates, as faculty, try and continue to defend science, the tradition that we're part of that is for everyone? It's not just for us. Science is very much intended to protect, serve, communicate, and bring the best of what we have collectively to the fore and provide protection. But how can we do this? It occurs that it's as much the discipline, the excellence, the integrity of science as it is in some ways engaging people around our lived experience, each person's lived experience, and in some ways values. We see the interplay, some tensions often in values very much today in so many aspects, not only climate and health and the field of climate change and our lived experience of year by year more extreme events, but in our collective response example to the COVID-19 pandemic, where some of the great science that has brought forth abilities to protect one another are diminished, to protect ourselves are diminished. So there's a climate in which science and the ability of science to speak to our protection collectively now and into the future is being questioned. We mentioned each of us in different ways, this range of individual responses to both the conflict in values, but to what we're experiencing as a result of climate change, from sadness to fear to anger to anxiety and depression. And this is more and more being documented in the scientific literature, not only in our lived experience. A recent spate of work looking at the individual responses, especially among young people. Half of people aged 16 to 25 years across 10 countries, not just in the US, but 10 countries say that concerns about climate change impact them negatively daily, on a daily basis. Same studies estimated that 77% of those people responding are frightened of the future. Another study, all of these quite recent, just out in the last year. Babies born in 2020 are are going to experience in a lifetime 7 times more heat waves than those people born in 1960. 96% of young adults in the US are saying currently that they're very or extremely concerned about their own children's well-being. It's kind of putting some numbers on what we know experientially. And we ask ourselves, how can science help respond in positive ways to people's concerns and values, help to negotiate that tension in values? Is it kind of speaking to how public health protections can enhance one's independence, one's ability to move freely in society, to move safely, to not put other people at risk? Is it the way that health contributes to well-being overall and personal freedom? I'll speak to some of my work with my colleagues, not only at Columbia and other universities, but at NRDC, which is an advocacy organization. We do try and speak to the local impacts of climate change. We find that tools like maps, making maps of environmental changes that are health relevant, estimating local health costs associated with climate sensitive events that are occurring more frequently, or estimating the impacts and costs among worker populations exposed to extreme heat, and always dealing with and considering the equity in it and inequity of these impacts really speaks to people in a local way that seems to have more currency, give people more ability to see themselves in the science and figure out how they can proceed, what to do next. Some of these efforts are having, I think, very positive changes. There's recent studies, polling that has just come out from the Yale Climate Communications Center that finds that there's awareness increasing. A record number of Americans now say climate change is happening, they're worried about it, and it's harming people in the US. More and more of a sense or recognition of the immediacy of climate change. It's a very personal issue. It's not happening to people elsewhere in a distant time only. It's now, and it's happening to us. And that seems to be increasing support for public action. The same polling by the Yale group found that 94% of liberal Democrats, one might expect perhaps more, and 80% of moderate and conservative Democrats say that climate change is now a high priority for the president, for Congress to deal with. Perhaps less widely acknowledged is that in the same work, there's agreement that all parties, all people of all stripes are more and more interested. 61% of liberal and moderate GOP voters and 24% of conservative GOP folks said their party needs to be doing more on climate change. So perhaps we're at a point where it's becoming less of a partisan issue and more of an everyone issue, which seems very much like it's the same emphasis on enhancing science more and more so that it is for everyone and speaks to everyone. It's not only the science, the people, but it's very much the laws. Law is a friend of ours when it comes to coping with dealing with climate change. And there's an awful lot of great positive legislation that's happening currently at the federal, at the local, at the international level. I'll mention just a few steps that have been taken recently, just encouraging of all the good things that are happening for us as a country, as a world. The US has established an Office of Climate Change and Health Equity within the Health and Human Services Agency just recently. There's an interagency working group on extreme heat that's newly been established. EPA's Climate and Health Indicators Program is being refreshed and renewed. There's more funding being requested for climate and health adaptation, including within the Centers for Disease Control and Prevention, which is the only dedicated federal support for climate adaptation. New York City, there is the 4th New York City Panel on Climate Change, which is doing providing an assessment of the state of the science to try and inform how the city of New York can proceed to become better protected and adapt to climate change. Internationally, just ahead of the COP, the Conference of the Parties that will be in Glasgow later in the year, the US committed to doubling the amount of climate finance that will be available to the developing world. The US Treasury Department released a new guidance that will lead the US to oppose more investment in fossil fuel projects in future among multilateral development banks. China announced they'll stop building overseas power plants and instead focus on clean energy. The world's biggest carbon capture plant just opened or is in the process of opening in Iceland. There's an awful lot of very specific steps that are being taken. And certainly, as Jeremy mentioned, in the academic sector, both at individual schools and networks like the Global Consortium on Climate and Health Education, which is a network of over 200 health profession schools around the world. There's so many opportunities to put curriculum into place, to provide outreach to communities, to advise on adaptation and planning. Companies are providing more and more worker protections. They're providing ways for workers to be educated more on climate and health impacts. There's so many ways that you, the people who are listening, can get involved increasingly in these issues and in public action. The issue is to create demand for a future that the next generation will want to inhabit and to believe and invest ourselves in participating in that future that will be one that they'll want to inhabit. There's so many ways for us to get there, but part of it is both honoring the reactions that we have, both negative and sometimes outrage to the climate and health impacts that we see, and also focusing honestly on solutions, not negating either, but finding that middle path and reaching out, as Jeremy, you said too, to one another to make common cause, to provide a sense that each person is not a sole actor in this kind of endeavor to educate ourselves, talk about what we know, find the path to action, and take it in many ways and apply our creativity. So that might be a slightly different approach to, rather than the climate and health side. As Jeff, as you mentioned, I've done research with colleagues and partners at NRDC and Columbia on heat and air pollution, but more and more, perhaps informed by the extreme weather events of recent years and the experience continuing of dealing with international global pandemic. It seems like more and more a conversation that we're having is about how do we find common cause, make it, and help motivate ourselves and one another to action that will make science and climate and health science more and more for everyone. So with that, I'll stop and say thank you. It's an honor to be part of the conversation, and I look forward to everyone's questions. Thanks.
Thank you. I am going to briefly share my screen too and pull up, hopefully if it works. Did it share? For some reason, oh, there we go. Okay, I'm getting. Can you see? Okay. Is it working?
It is.
Okay. So this is a slide that I was very pleased that Jeffrey already included in the materials. And I'm bringing it up because it is sort of a nice summary slide hearing the issues that we're talking about and things. I love it when things work out and we did exactly what we wanted. We presented it, talked about the call to action, both on an individual level through the university, as well as what needs to be done on a personal level. A couple of themes that are going through that are really important is we are seeing more and more evidence of climate change, not just in terms of the science, but also recognition amongst not the population, whether you measure it on a local level, on a national level, or an international level. A lot of the things that you're seeing the difference, at least my studies have shown, is it's less a acknowledgement of climate change, but more a willingness to pay for means to mitigate it. And so what you're getting into is very real disagreements as what we should do about these things, going into sort of generational equity issues and generations having very real differences of opinions about the necessity of this, in large part because of the immediacy to different types of folks and what's going on and what issues that you're stating. Public action is obviously a really important issue. And one of the things that I always like to remind people is that environmental issues and climate issues didn't used to be partisan. It didn't used to be that environment was a Democratic issue and anti-environment was a Republican. I like to remind people that the Clean Air Act, the Clean Water Act, the Resource Conservation Recovery Act were all passed with almost unanimous votes. And that the US EPA was created by President Nixon, a Republican, not a Democrat. So, going into making these things a partisan issues goes back to what Jeremy focused on in terms of communication issues, is that we all have to have clean air to breathe, clean water to drink, adequate nutritious food to eat. And so there's no reason for those kinds of things to be as partisan as they are. So communication strategies and ways to deal with it are going to be extraordinarily important. So science, and going back to what Kim was talking about, sort of the attacks on science and the foundations of science, I would expand that to attacks on academia and government as well. Less faith in concepts of regulation and regulation being viewed as just antithetical because it's being regulated. A number of the strides that we've made in terms of improving air quality and improving water quality, and it's not perfect, but we have made strides, have because there have been regulations in different types of things. And the concept of those statutes before was that it would be continuous improvement. And at some point, we lost the concept of continuous improvement. So that's one sort of my concluding thoughts in terms of summary. With that, I am going to take my screen back. Hopefully I can do that successfully. Oh, did it work? Did not work. Okay, I may need help with that. Oh, here we go. Now it's going. See, before it was capturing it and not advancing it. Now it just grabs it. I apologize. And what I'd like to do is make sure I have a call for questions and see if anybody else has questions. I do not see any posted in the chat. Have I missed it? Nobody has questions, so that means I get to ask questions, which is awesome. So I'm going to ask each of the panelists, or at least awesome for me, one of the questions that I like to do, which is sort of the, oh, Beth has one. Let me go through that. She asks, is there any connection between the pandemic currently and climate change?
Well, I guess I'll take a stab at that because I've been so involved with the pandemic. My first answer to that is actually no. I say that when I look at it to say that it's important that we use an evidence base and not bundle everything up as a climate change problem, because that dilutes and complicates the ability to message this correctly and focus on the real important devastating consequences associated with climate change. That said, there are certainly stressors that the climate system imposes on our world, and additional stressors that humans impose through deforestation, fragmentation of habitat, breakdown of the animal human interface, that climate change may play a role in, that could facilitate the spillover of new pathogens and may have in the past. I think it's more to do with that level of development and deforestation and how we generally manage the ecosystems that we've been entrusted with, rather than something that's related to the warming of the planet per se. I don't entirely discount the possibility that there could be an effect there, but I do not personally think that climate change is an appropriate lens for viewing the spillover type events that we see that have seeded the types of near start pandemics, or in this case, an actual pandemic. And I certainly don't see it as having had any real effect on the outcomes as we've seen it, which unfortunately were a function of the epidemiological characteristics of this virus, unfortunately.
Thank you. I see Barry has a question. Barry, do you want to unmute yourself and ask it? Oh.
Hear me?
Yep. Yeah, we can hear you now.
Okay. So thank you everyone for the wonderful presentations. Seems like you guys put a lot of thought and effort into it. So I want to start off with that. So my question is, so it seems like there's nothing we can do to kind of reverse it. It seems like we just have to take it how it is and kind of just prepare for what's to come. Because that's kind of what I got from what everyone kind of alluded to, is that it seems like it's too late. So the best thing we could do now is just kind of prepare for the situations.
Kim, I'm going to let you, I have thoughts on it, but I'm going to let you take it first.
Sure. Barry, thank you for that question. I think it makes a big difference, the actions that we take now in the long term, largely. You're correct that it's necessary that we prepare, that we begin to adapt and think about adaptation, because we are committed to a period of the climate impacts that we're seeing already, and a period, of more time into the future. That said, the choices that we make in the way of our energy systems now will not only impact the way we live now, air quality now, because fossil fuel burning is a source of more immediate air pollution, as well as heat trapping carbon pollution that's causing climate change. But it's also going to make a difference in the trajectory of warming. In your lifetime, perhaps, and certainly in your children's lifetime, the amount of disruption. So it's a both answer. And I appreciate the sensitivity of your question. Yes, it is quite sobering that preparing and adaptation is necessary, but it's married with taking steps to reduce the sources of climate change. That is essential. We can't, I think, give up on either effort. So thanks for that question. It's really central.
Barry, you want to follow up? Is your hand still up?
Can I add one thing?
Yes, please.
It's very, very difficult to talk about climate change in a public setting without conveying hopelessness to the audience. And it's very important to understand that there are things that we can do in our actions. And Kim spoke to that just now. I think it's also important to recognize that while we do not have a magic bullet to reverse this, there are endeavors underway to try to do things that would actually decarbonize the economy and to pull carbon out of the atmosphere and the ocean. I'm not particularly bullish that these are going to happen at scale very soon, but these are sectors where there's really active research to actually do carbon capture sequestration, to move renewable resources to a point where they're central to our economies so that we can cut our carbon addiction and actually really slow things. It doesn't obviate what Kim said, though, that we have a certain amount of warming that's almost unfortunately baked in, and that's a bad choice of words, that we are going to have to contend with along the way.
Jeremy,
Yeah.
do
I'm
you want to add?
Yeah, I'm sorry. I just want to kind of add on to that.
Okay.
So does it make more sense? So do you see in the next several years or decades, like everyone moving like to Idaho or that kind of stuff because the coastal is just so dangerous? Like places in like Midwest America. I just wanted to hear your take. Everyone's take.
Okay.
Do you want to jump in, Liz?
No, go ahead, Kim.
Millions of people will move and migrate. Millions more probably will not be able to. So I think that that's a really important set of questions for us to try and grapple with, not only as scientists, but as a society. Where will people be moving to? What will be the experience and the challenges for the areas to which people are moving? And we're going to have, sensitivity, good science, and even better social systems and a sense of compassion, an appreciation of equities and inequities, and how to diminish the inequities and help people get to where they need to be, literally and figuratively, to be safer and have a sense of home. That's going to be a big one.
And it's already started. We're already seeing climate, not migration. We saw it in the beginning very dramatically with Hurricane Katrina, where we saw folks moving from New Orleans, and it took some of them years to get back. Many haven't got back. We're seeing it now in areas where people are being displaced by fires and different things. All that kind of movement is climate migration. One of the other things I like to remind students, because teaching this stuff, I'm often accused of being a buzzkill, right? It's sort of doom and gloom. I'm sure all of you have the same thing, and we are talking about that. I'm like, oh, I didn't know it's so bad. And we all have both individual and collection powers beyond us. And so I like to remind people that political action starts at the voting booth. You can demand of your elected officials that they think about these and hold them accountable. But it also doesn't end at the voting booth. Taking part in different types of not just demonstrations, but making sure that you're involved in comment making and doing different types of things, being involved in the policy is going to be really, really important for you, the younger generation, to get and demand what you want. I have a question from Sarah. She says, I'm really interested in our plastic pollution crisis and how it relates to climate change. Do you think our plastic use is driving climate change? Isn't there any research in the field about this? Anybody want to talk about plastics?
I can touch on this. I have thought about it and looked at it a bit. Certainly the production of plastics is an energy intensive enterprise. And as Jeremy could certainly attest, within the medical care industry, plastics are everywhere. They provide the capability for cheap, ready, sterile instrumentation and protection against infection, and they're used all over the place. However, they do not decompose on the timescales that we would like to see. They take carbon from the ground and they lock it up in these plastics, but they form another form of waste, including the microparticle pollution and the macroparticle pollution that we see in the oceans that are accumulating in these anticyclonic gyres out there. I actually don't see them particularly as a strong contributor radiatively or in any other way to the problem of climate change, but I look at it as part of a problem that we have that's even broader than climate change, perhaps, which is waste. And you can look at carbon dioxide as a waste product. You can look at the plastics as a waste product. You can look at agricultural runoff as waste products. You can look at uranium as a waste product. Humans have not done a very good job at managing their waste. And plastics are one more example of that, and how we're not using our planet's resources in a sustainable, renewable fashion that will allow for long-term livelihood and human health.
Anybody else? Jeremy?
Well, I'll add to that. I mean, Jeff nailed it. I think one other piece that I will add to this is that as the fossil fuel industry comes under increasing pressure and there's divestment, and I don't necessarily mean politically motivated divestment, but just movement away from use of fossil fuels, that industry will pivot more directly towards plastics and plastic production, and will probably use a lot of the same tactics that it and other industries like the tobacco industry have used to obscure some of the potential health impacts and the devastating impacts on ecosystems. So I think there are, exactly as Jeff said, some overall important thematic connections to recognize that the systems operate in similar ways. The dynamics of the systems are similar, but from a physical science standpoint, plastics are not directly driving climate change.
Okay, I have a question from Daniel Liberts. He says, I worry about future propaganda efforts, organized and not, that will try to discredit climate progress that is being attempted, and hopefully will happen more and more. Given all the issues with COVID and the election controversy, social media and gaming algorithms for anti-science and anti-government messaging have done so much damage. Are there academics and organizations preparing for that propaganda machine to be directed at climate in the future? Not that it isn't happening now, but will we be probably happening more as it becomes a mainstream political issue?
I'll take a run at that, since one of my homes is an organization that's focused on advocacy. I think that the approach of many non-governmental organizations who are trying to defend environment and environmental health is to watch what's happening, if not a campaign to prepare for that eventuality, to be ready to move with motivating a membership base, with activating any kind of legal or legislative advocacy, and to be ready for those disinformation campaigns as they happen. And also a lot of NGOs have gotten quite focused on their own communications and social media as a way to lay out scientific evidence to counter the misinformation. So to some extent, there are a lot of NGOs who are ready for that type of assault.
But it's a challenge that's new, and we're all learning. And that's one of the things that I liked that Jeremy said things about learning it again. When I was a girl growing up in the 1960s, we had 3 TV stations and a handful of radio stations, and there was a handful of newspapers. So everybody was hearing essentially the same news message. And when you wanted to get your thoughts across, you had limited avenues to address them in order to get a very, very wide audience. Right now, when we have sort of a choose your own news, or choose if you want news at all, kind of a mentality in things, it's complicated getting communications, because often the people who need the communication the most aren't open to the person who wants to do the communication. And so we're really going to be needing to working on that and doing things. I mean, I like to listen. If you go and you sit down and you listen to Fox News, and then you listen to CNN or MSNBC on the same thing that's being reported, very often it's like you're on different planets, the different orientations as to what's being done. And those are just 3 avenues. And, you know, there are hundreds of them in terms of doing. So this is complicated, and it's very, very important. And it's something that, you know, my generation is learning many ways from your generation, and you all are going to have to be really crafting new ways to address this problem. Jeremy?
I'll add on to those excellent answers that there's been some really good work by, particularly by colleagues at George Mason University and at Yale, looking at climate communication. And a lot of it focuses on health, but it's not only related to health. And one of the, I think, most trenchant insights that's come out of that is that simple, clear messages repeated often by a variety of trusted sources are quite effective at communicating, particularly the fundamentals around climate change and impacts, and also potentially about some of the gains that you mentioned in your question. And so taking a very matter-of-fact approach to how to encourage that kind of communication that reaches lots of different communities is the way to go. And that's what those communications experts have done. They've invested in building networks among trusted groups, and that may be in healthcare, it's actually nurses that are more trusted than anyone else. So encouraging nurses to speak up about climate change. And I was really gratified that one of our charge nurses from our emergency department, I was able to recruit her to speak at the webinar that we did on rapid response. And she provided her perspective, and it was very moving alongside the perspective of some physicians. That was also important. But and same thing for weather forecasters, that meteorologists are actually a very common source of information about the weather and a trusted source of information about the weather. And so there's been a long campaign to engage meteorologists and broadcast meteorologists in particular to support that, and it's been effective.
Okay, well, thank you very, very much for all your thoughts and things. I am going to go now and ask each of my panelists to give us a few pearls of wisdom to wrap up. And so we'll go in the same order that we started. Jeffrey, do you want to give us our first pearls?
Sure. I think what I'm going to say is that, the climate problem is something that requires all hands on deck. And that doesn't just mean all of us individually. I'm actually going to say it means all sectors on deck. We have an enormous need to not just further the science and understanding of it and further the health response. We need things like climate finance and climate entrepreneurship and injection of climate related business practice into the markets and ways to structure it, where we have to work with business schools and corporations and understand what that means. We need to bring it even further into architecture and urban planning so that we can design the kind of communities and cities and landscapes and living environments, particularly in vulnerable population areas, that are going to protect us. We need it in law. We need it in policy. We need the things that are actually kind of boring for some of us and really exciting for others. We need to understand permitting and regulation in ways that we haven't before. If we're going to redo the electric grid to support renewable energy, which we need to do regardless of the fact that it's falling apart, we can't even put a mile of new grid down right now because the permitting and regulation issues are vast and enormous. We need people who are coming at this from a climate vantage, who want to make for a greener world, a more sustainable use of energy, and recognize that there are some real issues that are not just legislative, but local policy and permitting and all that type of thing in order to actually make it so that we can advance to a cleaner environment. So I think what we have in front of us is something that requires a vast array of sectors, not just science and engineering and health, but communication, arts, humanities, anthropology, business, law, policy, architecture. We need everybody. And it's going to take that in order to actually tackle this problem, minimize the impacts while trying to develop solutions, maybe to stave off some of the worst effects entirely.
Thank you, Jeffrey. Jeremy?
So I'll dovetail on Jeff's remarks, and a word that I didn't use, but that it comes up a lot in climate change assessments is transformation. We need transformative change, and what Jeff just described is the foundation for transformational change. And I would add that we need to expand our conception of what's possible. And I mean that in two ways. We need to envision a future that doesn't rely on fossil fuels and is fundamentally more equitable in the distribution of its impact and its wealth. But we also need to recognize that what's possible in terms of the environmental exposures and impacts that we have experienced or that we may experience in the future is not really as reliably defined by what we've experienced in the past. And so we need to continue learning. We need to be very open to possibility and visionary, but we also need to recognize that the past is no longer a reliable guide for the future in terms of protecting ourselves and our communities. And we need to take that to heart. We need to work very closely with one another and hold our institutions accountable. And I mean this from top to bottom, to engage in this more forthrightly. And it's not just about emissions reductions. It's about preparing for some of these consequences that are inevitable, and in some cases will be very challenging.
Thank you, Jeremy. Kim?
Great points. I really like where you started, Jeff, with the all hands on deck, all sectors. It's for sure not going to be limited in any way. And Jeremy, the point about transformational change, I'll kind of dovetail off of both of you and mention the challenge that we pose to ourselves to envision that we can do this, that this can be accomplished collectively. It's very possible, very easy to get sobered, deflated, diminished, and lose the ability to see those interconnections and have the creativity that each of you were, I think, referring to that's going to be necessary for us. So when I see something that's cool, that's innovative, that's amazing, that's working, that's almost working, reach out to those people, get in touch with them, find out what they're doing, how they're doing it, and try and learn humbly from the efforts that are working or almost working, and bring someone else along. Get involved, find myself or ourselves in what looks like the solution, and bring others along, and refer again to that collectiveness, so that there's less of a sense of being singular and more of a sense of we can do this, and then start doing it.
Thank you so much. I want to thank all of the panelists. This has been an absolute delight. And Mindy, I'm going to turn it over to you to finish up.
Wonderful. This has been a very stimulating and activating conversation. I think that the issues of that we need everyone, that we need all hands on deck, all sectors to create a transformation is very real. I have this feeling from the Yale data and also data from our lab at Baruch College that the students that we're talking to right now are activated, and they're activated for their own futures. We're talking about will the various political groups take this up? Well, they will, because there may be disinformation campaigns, but if you're living in a drought, if you're living in wildfires, if your house is floated away, you're in danger. Our students are very smart, they're wise, and they have an amazing communication network. And they know how to speak and connect with each other. So I actually have a lot of optimism that the people that we're speaking with now will speak with others. And this is the beginning of creating the demand. And I don't know if it was Jeremy or Jeffrey who said it, but they use the word demand. And the word is demand. There's no way to be sort of nice about it anymore. We have to demand a change, and that change needs to come. And I think it will come from the voices of the people who are sitting on this call and who are in our classrooms. We have very smart people who are growing and learning and taking up climate change because it is their future. So I really appreciate the panelists today for bringing your insights to us and activating all of us to move ahead and make the demand that our communities, all of our communities across this planet really need and deserve. So thank you so much. And Elizabeth, thank you so much for being such a wonderful moderator. We really appreciate everyone's contribution today. I also want to say that with regard to planning, there's been a lot of conversation about planning. There are plans afoot in New York to make New York more resilient. Next Thursday, at the same time, October 7th from 4 to 5:30, we're going to have a conversation with Janie Bavishi, who is the Director of Resiliency Planning for New York for the mayor, from the mayor's office. Also, Brett Bronco, who is the Director of the Jamaica Bay Resilience Institute. And we'll also be hearing from Alice Hill. She's the author of Building a Resilient Tomorrow. She's a senior fellow at the Council on Foreign Relations. I think that those speakers will follow up nicely from this conversation, which is we have challenges. Those challenges need to be met, and what's being done to start to build the resiliency that we're all going to depend on. So please join us next week. It's in the Baruch News. The link for that conversation. Please come and be part of that. And again, thank you so much to Jeffrey Shaman, Jeremy Hess, Kim Knowlton, and of course, Elizabeth Geltman for having this wonderful conversation today. And thank you everyone for coming, for joining us.